gives me great pleasure to launch the Nursing Now Australia campaign here in Sydney. Nursing Now began as an initiative in response to the release of the Triple Impact Report by the UK's all-party parliamentary group on global health, which was founded by Lord Nigel Crisp, the former Chief Executive of the National Health Service, and of course our guest speaker this evening.
The first thing to say really is, of course, congratulations. Congratulations for launching Nursing Now, and congratulations to all of you for coming together. I have to tell you, it's an extraordinary growing global movement. When I left England, it was 192 regional, national and local groups. I think it's about 200 now, and that's only in 2 days. Over 80 countries. You're launching today a number of champions. We've got the Duchess of Cambridge as our patron. We've got an actress some of you may have heard of called Emilia Clarke. 24 million nurses and midwives worldwide, half the professional health workforce, systematically, and I think it is systematically, undervalued and unable to work to the top of their licence. And our aim is to improve health globally by raising the profile and status of nursing.
Congratulations on launching the Nursing Now campaign in Australia. I bring you greetings from the 20 million nurses that I represent around the world. Nursing Now is a great campaign for bringing nurses together across the world to increase the profile and status of nursing.
It's not about nurses talking to nurses. It's about nurses influencing the decision makers and the policy makers around the world, the people who actually have their hands on the purse strings and create the policy. That's who we're here to influence.
The work of nurses is profound. And I say this obviously from a deep personal position. My mother was a nurse. My wife was a nurse. And to be able to see them and their passion, but then to see every day in my role is to witness the absolute best of Australia.
And I get asked from time to time, what would I think would be a good result of this campaign? And actually one of them would be quite simply that all your health ministers in this country, or actually preferably the premiers of your different states, could give this talk.
As the Commonwealth CNMO, I am very pleased to support the work of Nursing Now and very pleased that we could have Nigel here with us for the launch. The professionalism of nursing and midwifery has always been essential to good care. To support achieving the aims of Nursing Now, we must not only behave in a professional way, but we must also be able to articulate what professional nursing means and the value it brings to the delivery of healthcare, and how our professionalism supports us in our contributions to policy development and implementation.
It's been an extraordinary privilege to be on the board of Nursing Now, and one of the richnesses that it has brought for me personally is that many of you have invited me to come to your conferences around the country to talk about Nursing Now. And that's wonderful because I get to talk for maybe 20 or 30 minutes, but I get to sit for 1 or 2 days hearing the extraordinary stuff that's going on around Australia. And it's at the lead up to International Nurses Day 2020, and it gives every nurse around Australia the opportunity to do something to raise the status and profile of nursing.
The Nightingale Challenge. This is a very simple method. It is actually saying to employers of nurses, value your young nurses.
As nurses, we understand the inequities that exist across our health system, and we know that nursing can provide the solutions. God knows we know that nurse practitioners, they are the answer if only the right questions would be asked.
I hope I managed to get the organisations that have contributed to the development here, but I also put plus at the end, just in case. Because Nursing Now is nothing but if it's not inclusive. We want everyone to be part of this.